that are they only an adjunct treatment, or can they actually prevent antibiotic misuse? That is one which Dr. Komal will answer. And then Dr. Indu will answer the one on whether these polyherbals can interact with antibiotics and antihistaminics. So first, Dr. Komal, please.
Yeah, so sir, this polyherbal formulations, which contains the different medicinal herbs, they have the anti-inflammatory properties, the regenerative properties. So we can use it instead of going directly to the antibiotics. Yes, it has both preventive and therapeutic effect. So we can use this in both the cases. Instead of directly going to in the early stages of cough, directly going to the antibiotics, we can use this polyherbal formulations very safely.
Right. So, Dr. Indu, will they interact with the antihistaminics and antibiotics? Sorry, you're muted. You can't hear you.
Okay. Not that I'm aware of. Okay. But I may not be right here, because if there are some heavy metals and if they were to interfere, I'm not aware of that.
Yeah.
But your simple regular home remedies would not interfere for sure.
Yeah. Yeah. Okay. So there's another question about do you ever, I'm reading the question from the chat box, do you ever initiate empiric inhaled corticosteroids in a patient with acute cough when asthma is only a differential diagnosis? It's an interesting question. Let me take it up to answer this. So what this doctor is asking is that you're not sure it is asthma, but it is a possibility. Now, would you initiate inhaled corticosteroid and see what happens? So this is a double-edged sword. So not only asthma will improve, a lot of other things which look like asthma will improve. Some will improve on their own, with or without treatment. Some kind of things, for example, post-infectious cough will also improve. So we would start inhaled corticosteroids in a case like that when it's not simply a differential diagnosis, but we are reasonably sure. We are reasonably sure. How can we be reasonably sure? There is a strong family history of allergy. This person has had an impressive history of sneezing in the past. He has watering in the eyes. Now, first time he's showing signs of something happening in the lower air tubes. The lung function is slightly affected. It is slightly obstructed. There is some amount of reversibility. Eosinophils are there. Ig is high. There is a very strong likelihood that eventually this will turn out to be asthma. Here we can give a trial, and if that helps, we are then reasonably sure that yes, we are dealing with asthma. Let me go on to some other questions now. In the absence of, this is for Dr. Indu, in the absence of fever or systemic signs, what clinical clues most reliably distinguish an infectious cough from a non-infectious cough in a child?
So if you, I feel if it's a wet cough, you would think it is infectious and bacterial. If you have cervical lymphadenitis, which is also a marker of inflammation, this could be bacterial. I've already mentioned to you if you have an ear infection, so you have any other features which are markers of bacterial infection, you would think it is bacterial. Yeah. For non-bacterial, if you have any other systemic manifestations of allergy, say, so you have the salute sign, or you have allergic rhinoconjunctivitis, or history of asthma, presence of wheeze, presence of rhinorrhea, are all markers of non-infectious causes of cough.
Yeah. So somebody has asked a question about this cough hypersensitivity syndrome. So there is an entity called cough hypersensitivity syndrome. Now here, usually after a viral infection, some changes occur in the cough receptors in the respiratory tract, and now the patient starts coughing. Every test is normal. But the clue is that it follows a viral infection. Unlike post-infectious cough, which sort of settles down in 2 months, this does not settle down. And the major factor in provoking cough is cold air. Breathing in cold air, breathing in strong smells, cough, cough, cough. Here, many times, all our therapies don't work, and we have to look at gabapentin, for example, or amitriptyline, for example. Dr. Jay, are there more questions? The ones which were there in the box I have dealt with. Are there some more questions, Dr. Jay? Can you come in?
No, sir. No, sir.
Okay. So I think we have 1 minute left now. So